When a family needs to find a senior care facility, it can be a hard decision even without coronavirus concerns. What do you do if you need their help now? Our colleague Philip Palmer tells us what you should look for when you're picking a facility for your loved ones.
In LA County, 52% of COVID-19 related deaths were people living in skilled nursing facilities. So how do you identify the type of senior care your family needs and where they can safely live?
There's too many options, there's too many variables, there's too many pitfalls.
Diana Simons began her search for assisted living in the early stages of the COVID lockdown and immediately turned to elder care specialist Leanne Allman, who feels step one is knowing her clients.
What does the family need? What are their concerns? What does mom or dad actually need? What's the doctor requiring?
But how do you find that care during a pandemic?
In the best of times, it is a daunting task.
It's one thing to know that a facility is great, like this one in West Covina, but is it great for you and your family? And how do you find out if you can't go inside because of COVID-19?
It's imperative that you work with somebody who's actually been at the location.
Just last year, the backlog of investigations at skilled nursing facilities in LA County had grown to 5,000, and that was before the COVID pandemic, which has led to a County Board of Supervisors motion requesting an inspector general to oversee skilled nursing facilities immediately. Terry McGee and his family care for 150 people in over 20 board and care homes. So far, he's not had a single COVID positive case. His advice is to be wary of facilities not asking you questions.
If they're not asking you, where have you been? Where has your loved one been? Who's been in contact with them? Who has done all of these things? They're not doing their due diligence. They're just accepting somebody because they want to put a butt in the bed and they want to make a little extra money.
The Regency Grand in West Covina hasn't had a positive case to any of its residents. Co-founder Tom Stanley says that's due in large part to safety protocols in place for months now, which includes testing all residents and staff for COVID-19. He says you can learn a lot about a facility from the outside.
If you drive by a community and you just see people going in and out, or often frequently you'll see a sandwich board on the sidewalks, tours daily, come on in. None of that stuff should be happening.
So if you find yourself looking for assisted living, first off, take control.
Interview the owners. Ask to speak to the staff. Ask to see what they're doing for safety. Don't be afraid to ask the questions. Ask anything that's on your mind. There's no bad question.
Trust your instincts. Get on the phone. If you feel like somebody's full of a bunch of BS, red flag. Move on to the next provider.
If you aren't comfortable in that role, find an expert you can talk to in person.
The same phone call that you would have made, I'm calling up saying, here's what Mrs. Smith looks like. Here are her needs. What is my estimated rate?
Even in regular times, it would be necessary, but in these times, it's just really beyond necessary.
Philip Palmer, ABC 7 Eyewitness News.